A very good afternoon to all of you. Welcome to the LSE for this online event. My name is Andrea Meniken. I'm Associate Professor of Accounting and Co-Director of CAR, the Centre for Analysis of Risk and Regulation at the London School of Economics and Political Science. This afternoon, we will talk about transboundary crisis management in Europe in the wake of COVID-19. This is a live event that has been jointly organised by the departments of Government and Accounting and CAR at the LSE. The event is part of LSE's public event series COVID-19, the Policy Response. COVID-19 represents a critical transboundary crisis. COVID-19 knows no territorial boundaries, and it fundamentally challenges the boundaries of state action. Many national responses to the pandemic, as we've seen, have caused further transboundary crises in themselves. What are the emergent lessons that can actually be drawn from this pandemic for political crisis leadership? What can we say about the resilience of liberal democratic political systems in Europe? What lessons can be drawn for multi-level crisis management within and across nation states? This event brings together leading experts to consider these questions, and I'm very pleased to be here to welcome Arjen Boyn, Lydie Caban, Nick Sitter, and Martin Lodge as our speakers today. I will briefly introduce them in a moment, but let me first introduce you to the format of this event. So we will start off with statements, opening statements from each of the speakers. Then we will have an interpanel discussion, and after that, I will open the floor to questions from the audience. So please engage in our debate and submit your questions via the Q&A button, which you can find on the bottom of your screen. Please type short questions into the Q&A box, and if possible, include your name and affiliation and any links if you have them with the LSE. Questions will be submitted directly to me, and I will try to pose as many as possible to our speakers. For those of you who are Twitter users, the hashtag for today's event is LSE COVID-19. The online event is being recorded and will hopefully be made available as a podcast subject to no technical difficulties. So let me now briefly introduce the speakers. Arjen Boyn, who will speak first, is Professor of Public Institutions and Governance at Leiden University, and he's an expert in crisis management and leadership. Lydie Caban, who will talk next, is Assistant Professor in Governance of Crisis at the Institute for Security and Global Affairs, also at Leiden University. And she has an interdisciplinary background in sociology and political science. Nick Sitter, who will speak then, he's Professor of Public Policy at the Central European University, and he's also Professor of Political Economy at the BI Norwegian Business School. He's a leading authority on populism and democratic backsliding in Europe. And then Martin Lodge, who will speak last, is Professor of Political Science and Public Policy at the LSE in the Department of Government, and he's also the co-director of CAR. All our speakers today have also been involved in a joint international research project. That research project was funded as part of the EU Horizon 2020 research scheme, and that project looked into transboundary crisis management and Europe's transboundary crisis management capacity. And we look forward to hearing from all of our speakers, insights from this project and how these can be applied to the pandemic we are facing today. If you want to learn more about the project, you can visit its website on transcrisis.eu. But now I'm delighted to hand over to Arjen, our first speaker. Thank you for taking part in this event, Arjen. Over to you now.
Well, thank you, Andrea. Thank you for having me. And let me just start by pointing out the obvious. Is we're looking at a super transboundary crisis, as you just told us. And when we were thinking about this in our project, we were very interested to see, what would it take for countries to sort of collaborate across boundaries if they were facing crises that develop across boundaries. So what kind of capacity would they develop, or would they choose to go it alone? And I think the first observation is, I wouldn't have expected this, but what we're seeing is that most countries are going it alone, and they're developing their own approaches. And so it's interesting to see what has happened if we look at it from that perspective, from a crisis management perspective. So what has brought this absence of international collaboration and coordination. What has brought us, and maybe that will help us to understand, what we need in the future. So if I just briefly go by the main tasks of crisis management, and we see, I think we see a few patterns. So the first one is detection, and we expect crisis managers to do everything they can to detect crisis in their earliest phases. And I'm going to go out on a limb and say that most countries, it's almost inconceivable, but we're late in recognizing the emergence of this crisis, somehow thinking that, this is not going to happen to us. This is happening to other countries. It's not going to happen in our country. We're prepared. We have a fantastic machinery. We're going to deal with this. And that just, we're beyond that now, but it just evokes the question, how was that possible? The second point that I would like to make is that in all of these countries, you see authorities wrestling with the uncertainty that comes with this crisis, and it's an ever evolving uncertainty. First, it was about how many people have the virus. Now we're at the point where we're asking, what are the consequences, long-term consequences? How can we get out of this? How we can phase out of this? So we've seen this super interesting relation or non-relation, because there's a lot of variety there, between authorities and experts. So between the domain of experts, usually ignored under normal circumstances. In some countries, like Holland, the prime minister goes out and says, we do everything that the experts tell us. In other countries, they, leaders make a point of overriding experts. And the great absent actor here is the international expertise centers, like the ECDC or the CDC or the WHO organization, that somehow are absent in addressing the uncertainty in these countries. So we see the rise of the national experts. Decision making, how do authorities make the key decisions in these crises? Martin and I have made a difference between a pragmatic approach, kind of wait and see what happens and adjust, versus a principle approach where you take one overriding principle and use that as the source of the design for your strategy. We've seen that in the beginning, lockdown versus let's see what happens, and now we're seeing it in the exit strategy. But most interesting, we see a variety of approaches. So every country seems to be somewhere on a scale, but there's, again, doesn't seem to be a lot of coordination. And then finally, in communicating about all these approaches, what I've noticed is that countries communicate to their national audiences with almost a sort of blatant disregard for the idea that other countries are also watching what leaders say in their countries. So they're enlarging the uncertainty, confusion, and lack of coordination by pretending that there are no borders, or the borders are so complete that they don't have to worry about what happens in other countries. So all in all, I'd say transboundary crisis, complete lack of transboundary coordination, and up for debate is this good or bad?
Thank you, Arjen. Thank you very much. Let's now move to Liddy and her opening remarks.
Hello, good afternoon, everyone, and thank you, Andrea. I will prolong the discussion opened by Arjen, asking what cooperation is possible between countries. And I would like to talk a bit more in particular about what the European Union has done to respond to COVID-19 as a pandemic. So focusing really on the health aspects of the pandemics, what has been done and what it could do better. First, briefly, just some rapid element of context. As Arjen said, pandemics are transboundary crises. They affect really countries across border, and they require cooperation to tackle them. This is especially true in the European Union, where we share our borders, where human goods, but also viruses can freely travel. So which means that it is crucial for European member states to cooperate. Otherwise, we may end up in situations as the ones we have seen in early March, where member states unilaterally close their borders, do not cooperate, adopt travel bans that may not be efficient if your neighbor is still opening its borders. So we see that this cooperation is even more important within the European Union. As I say, at the beginning, it didn't seem to work fine, and then a series of measures have been adopted, and I will come back on this. I would like to recall a little something before I say more about crisis management. So what is the role of the European Union in health? I think this is a key issue to understand what could the European Union realistically do or not. So actually the European Union competence in health from a legal point of view is only to complement member states. So which means the member states are the first responders. They are in charge of their public health policies and their hospitals. However, the European Union can share this competence with member states in the case of what we call common health concerns, such as pandemics, because pandemics affect all member states. So this means that the European Union is not in a very well position to actually respond to a pandemic. The member states will first and foremost respond, while the European Union can only push a little bit for more cooperation, can incentivize this, but does not have all the cards in its hands. And I think that partly explains what happened and why the European Union has not been seen acting as it should have. So now I would like to discuss 4 types of crisis management actions that have been adopted or could have been adopted by the European Union. As Arjen and Andrea mentioned, I think these types of crisis management build upon the research we carried in the Transcrisis project, in which we also looked at other types of crisis management. So I think the first type of possible action is intergovernmental actions. Heads of states, ministers meet around the table or through Skype, and they discuss issues and adopt a series of actions. So we've seen a lot of that actually since the beginning of the crisis. Health ministers, but also prime ministers, presidents, and ministers in all sorts of domains meet on a weekly basis. This has been both essential to sort out some problems, for example, related to border closures, but it has not been enough. Why it hasn't been enough? First, for example, it's not clear what is the outcome of these meetings in the case of health. There is so far no joint actions, and I think member states could do more from an intergovernmental point of view. They could, for example, adopt a recommendation from the Council to ensure more consistency and coordination in their response to pandemics, for example, adopting a more common approach in terms of testing or quarantining. And for the moment, we see that there are very different approaches between countries, and this is a problem that could be solved. The second, actually most common type of action in crisis management is what we call multi-level coordinations. So it's about European Union institutions helping member states coordinating each other and promoting joint actions. And this is where the European Union has done the most. There has been 4 types of actions. I will briefly mention some actors. The first one is the European Center for Disease Control that Arjen already mentioned. Unfortunately, we haven't heard very much from this one. The ECDC, as a lot of experts, failed to see this crisis. It failed to trigger warning to European member states. Partly, I mean, this is due to its lack of competence. It can pool expertise between member states, but it cannot really raise an alarm. So I think we should really review the role of the ECDC to really empower it, to give its expertise more credibility and power in the face of member states. The second most common action is the role of the Health Security Committee, which reunites national experts at the Commission. Again, I think this committee has been meeting on a weekly basis, but we're still waiting to see the outcome of these meetings. Again, it could also have more power to adopt common decisions in terms of, to ensure more consistency in terms of medical approach, testing, quarantining, confining people. And the Commission could support that by implementing acts. So if member states adopt a decision, the European Commission can transfer it put it into law. And again, the role of this committee should be reviewed to strengthen its coordinating power. Third type of action, we've heard a bit of that, joint procurement. So member states can come all together and bid together for things like, for goods like protective equipment, medicines. This is essential. But as in the other cases, it came too late. Joint procurements were only available from mid-March to mid-April. This should have been the case early on from the very beginning of the pandemic to prevent member states from competing for essential goods like masks and medicines, as we unfortunately saw. Again, this should be reviewed to be much more automatic. Finally, the fourth type of multi-level action is what we call the civil protection mechanism, which is a mechanism for disaster assistance, which again revealed the lack of cooperation. Italy asked for the activation of this mechanism by early March, and no member state responded. They only responded afterwards, and its role is now a bit limited, which triggered some call for review by the President of the European Council, because this mechanism could do much more. And it raises in particular the question of how can cooperation be ensured when all member states are affected by the same disaster or the same pandemic. I think I've described the type of actions at European level. Now I would like to discuss two types of possible improvement for responding to pandemic and improving cooperation. The first type of possible cooperation would be is related to pandemic preparedness. And we've seen a lot of failures around that. Currently, pandemic preparedness is a national competence, so which means that member states prepare their plans on their own. And there is actually one decision from 2030 which requires member states to consult each other after they have drawn up their plan. So this is clearly insufficient because member states have no incentive to share information and to harmonize their plans. So one possibility here could be to adopt a regulation to provide templates and common procedures to ensure that to ensure more consistency amongst member states, which would eventually help coordination when the crisis comes. The fourth option is something that has been very heavily debated in policy circle, is the question of supranationalization. Should we give more power to the European Union to respond to pandemic? Is it a good idea? Is it desirable or feasible? Some have called for the creation of a European Union agency or of a Union of Health, or to give more powers to the Commission. I think these options raise a lot of concerns for various reasons. The first one is that, first of all, in the current legal setup, they are not possible because the European Union does not have a competence in health, only a shared one for some aspects. So such supranationalization will require a treaty change, which we know in the current setting is not easily feasible. Second, they also raise democratic concerns. It is very difficult to imagine the Commission adopting freedom-infringing measures such as lockdown. It really does not have the power or the legitimacy to do so. Citizens can only accept those measures if they come from nationally elected governments. And certainly, it's not clear that such supranationalization would be effective. We need coordination, but citizens are not likely to trust more a distant bureaucracy in Brussels when it comes to enforcing the lockdown. And tackling pandemics also requires a lot of local actions. Again, for example, contact tracing or change of behaviors. So we see a lot of problems if we want to actually enforce more cooperation at supranational level. That said, pandemics are extraordinary situation, and we really need to be able to do more in terms of cooperation. So we could, for example, think of a system in which we give more power to the European CDC or to the Commission to adopt decision, and then member state could still be in charge of implementation. This model exists, for example, also in banking, and that could be one way of improving cooperation. I will finish here and leave it over to Nick Sitter, who also have other things to say about the kind of problems the European Union faces.
Thank you very much, Lydie. Thank you. Yeah, now over to Nick. Nick, please.
Thank you. My task here is slightly different, to look at how COVID-19 and the crisis has affected the EU's ability to deal with other crises. And as an example of this, a prominent example of this, I want to look a little bit more closely at one of the crises we looked at in the Trans-Crisis Project, which is the rule of law crisis or the democracy crisis in the European Union. And my contention, I think, is that the European Union, its ability to deal with this has been reduced by the crisis. The crisis has made the rule of law and democracy crisis in the EU more acute, and it's made it more difficult for European Union institutions to actually resolve or deal with this crisis. So in the next few minutes, I want to make 6 points about this. The first is simply that there clearly is a rule of law crisis or a democratic backsliding crisis in the European Union. And the two most serious cases are Hungary and Poland. In the Hungarian case, the last 10 years, and in the Polish case, the last 5 years. In the Hungarian case, a matter of political centralization, new constitutions, undermining the independence of civil society, the judiciary, even the market. In the Polish case, primarily an issue of the judiciary. And both of these countries have been, are subject to the EU's so-called Article 7 procedure, more about this in a minute, and are being downgraded or have been downgraded by international democracy indexes. Point 2, so what? Why is this a crisis for the EU? Can't the EU simply leave sovereign states to get on with what they want? If they want to dismantle democracy or have an alternative, a liberal model, let them do so. My contention here is that this is problematic for the EU in two respects. First, that the EU really faces a dilemma here in terms of either it does nothing and runs the risk of undermining one of the fundamental building blocks of the union itself and of the single market, namely the rule of law, the workings of the rule of law, the fact that member states courts recognize each other. The other part of the dilemma is, what if it does something? It could push Poland and Hungary out of the EU or into a second tier of the EU. Furthermore, I think the last few years has shown that this actually has a geopolitical dimension as well. Hungary being pushed into the arms or walking into the arms of Putin, not so much an option for Poland, both of them establishing much closer ties to China than the EU as a whole is willing to do. So the EU faces a challenge here. Point 3, why hasn't the EU done anything about this? In the Trans-Crisis Project, we looked both at capacity to deal with the crisis and the political will to deal with the crisis. So I'll look first at the capacity issue. The capacity issue, I think, is linked very much to Article 7 itself, the mechanism whereby the EU can suspend certain aspects of member states' rights. This requires unanimity amongst the non-offending member states. That's a very, very high threshold. And I think it's fair to say that this is often described as the nuclear option, in as much as it was designed as a deterrent effect, rather than actually to have an effect. The second main tool the EU has is simply the ordinary infringement procedures. And these have been used sparingly, if not, I think, somewhat timidly. In the last few years, since 2014, The EU has also established what they call the rule of law framework. But in the end, this is more of an informal framework that only works in the shadow of the threat of Article 7. So the EU does have some tools, but it's been careful in using them and it's difficult to use them. That takes us to point 4, political will. Why has the EU not used these tools? I think the main reason is really a reluctance to go after a member state and criticize it for breaching the rule of law. In the Hungarian case, it was very much a matter of the centre-right party in the European People's Party effectively shielding one of their members. That's changed a little bit in the last year with Fidesz, the Hungarian governing party, being suspended from the European People's Party. And it's less so the case in the Polish case. But as long as there's unanimity required to do anything with Article 7, of course, these two countries will have each other's backs. And there are other countries in the EU, about half a dozen, that are reluctant to go down that road for other reasons. Furthermore, I think it's fair to say that neither the Commission nor the Parliament can walk away from the last few years unscathed in terms of assessment of what they've done. The Commission has opted to be very, very timid. For example, when it came to changing the guard of the Hungarian judiciary, the government did so by lowering the mandatory retirement age. The European Commission treated this simply as a matter of age discrimination, not as a matter of rule of law. Hence, the Hungarian Prime Minister, Viktor Orbán, was allowed to pack the courts with his appointees, only subject to paying compensation for age discrimination, thus getting a seal of approval from the European Commission. In the Parliament, I think the criticism is that both sides have been much more enthusiastic about prosecuting members of the opposite team, if you like, than members of their own team. So this takes us to point 5, which is, so what? Has the COVID crisis actually made this more difficult? And here I think there are 3 things worth giving a little bit of thought to. The first is all the noise and controversies at the moment about the enabling law in Hungary, the emergency law that gives the Prime Minister more or less effectively unlimited power on an indefinite basis. And the second is the controversies about Polish elections. But in my view, this is largely the two countries continuing on a trajectory that they've been on for respectively 10 and 5 years. So there's not that much new there. I think the really critical issue lies in how other developments with respect to COVID-19 have affected the European Union's ability to deal with this crisis in what was, I think, a few months ago, the most promising mechanism, namely linking rule of law compliance to EU funding. And the key point here is Italy. Italy has basically said, we want unconditional EU funding in the form of Corona bonds. Now, they won't get that, but they will get less conditional funding. This makes it very, very difficult for Italy, for countries in a similar position, to agree to attach conditions, rule of law conditions, to other forms of EU funding, as was until now being discussed in the context of the new 7-year EU budget, the multi-annual financial framework. And finally, on this point, I think it's worth noting that the German Constitutional Court's recent ruling will probably be used by both the Polish and Hungarian governments to justify their assertion that national law or national legal systems in some cases are above or more important than the EU cases. So to wrap it all up on point 6, for those of you who are still counting, what can the EU do about this? I think I see 3 trajectories ahead. And using the framework that Martin and Arjen have written about in their blog recently, and Arjen mentioned about the difference between pragmatic and principled approaches, I think what is often thought of, I think, at the EU level as a pragmatic approach is not to do very much, which they've been doing up until now. And that takes us back to the initial dilemma of if you don't do anything, you undermine states. I think that's the most likely way forward. A second possibility is what you might label a confrontational approach, to take a principled stand and say we must defend the rule of law in the EU, it's a matter of the treaties, and to confront Poland and Hungary, which will either lead to an Article 7 ruling against them and possibly push them out of the EU, or lead to the failure of an Article 7 ruling in which case we're back with the ordinary dilemma again. And finally, there is, I think, a third possibility, which is how I think I'd describe it as a sort of pragmatism plus, a slightly more forceful pragmatic approach, would be to use the EU's current instruments to put more pressure on Hungary and Poland and to try and contain democratic backsliding in these two cases and make sure it doesn't spread further. The key to that, however, is linking spending to the rule of law. That's it for me.
Thank you very much, Nick. Thanks for these insights into how the COVID-19 crisis might or will actually affect furthering of democratic backsliding. Now over to our final speaker, Martin Loch, who will give us insight into multi-level coordination issues. Martin, please.
Well, yes, a few comments about sort of the capacity constraints that we may be looking at. And I think it's worth noting that we are discussing this in a context of a much longer sort of set of trends which affects the capacity of transboundary systems of governing, even when they might already exist, to actually function. And one is what one might argue renationalized politics, the need or the demand by national politicians to be sort of campaigning on national topics, to be saying that the EU is something not helpful rather than a solution. And equally, and possibly particularly important when one thinks about procurement, one also talks about high degree of fragmentation of administrative machineries across nation states. And thirdly, one might also argue possibly limited readiness, despite existing transboundary scripts, to actually operate these scripts when asked to do so by member states. So these are sort of three background conditions. But I think where this particular pandemic is offering us some interesting or important insights is sort of for the future. It's sort of not much where one might argue sort of the acute responses, lockdowns and so on. But I think sort of the key question now for transboundary crisis management is sort of how to deal with sort of the ongoing crisis, if it still can be defined as a crisis in the framework of ION. It is still urgent, it is still threatening, and it's still defined by high degrees of uncertainty. So, and I think there's sort of three elements here which makes this quite peculiar, you might say, or a unique set of crisis management stress points. So one is what one, for lack of better word, might call it the ongoing creeping nature of this acute crisis. So we have had now here a lockdown in the name of public health, but other systems have evolved, and we don't really know when let's call it the great unfreezing of social and economic system emerges, what is actually still alive, how will we return in a sort of semi-defrosted states as a higher education institution, for example. So many more crises will emerge in other systems, which are not just about public health, and they will sort of turn up over the forthcoming months. And here again, the question for both national, regional, but also EU institutions is there really a clear way to think about who should be in charge of dealing with these various creeping crises that will emerge, because ultimately there will be calls, just as now, for consistent administration, some degree of joint principles and such like. The second key challenge, I would say, is what again, for lack of a better word, is I would call sort of the forthcoming twilight zone between ongoing crises, which is basically return to specific lockdowns or emergency provisions, and sort of the emerging world where you might call it risk management, where basically we sort of operate in social distance way and whatever happens, but there will be ultimately the need for some degree of monitoring and so on. But this twilight zone is highly demanding on everyone, not just on us as individuals, but also on any form of administrative system, because it exactly happens in the between the sort of day-to-day life, you might say, of normal operations and the world of crisis rooms and emergency provisions. Trying to organize that, I think, is so far unproven territory for many institutions. It usually works very poorly when it comes to the kind of the development of an acute crisis, but I think it's even less proven when it comes to the management of an ongoing, possibly very long-term kind of crisis. So that's sort of the kind of question. So these 2 points, the creeping nature, the twilight zones, are basically what to do with sort of these, let's call it emerging snowflakes in the economy and in society. And then there's a third point too, where I think there's a clear overlap between sort of the topics that Nick has been talking about, and sort of the concern with what is the European Union actually doing here, not just sort of in terms of actual crisis management, but sort of as a system of values. And that goes about, or is about the emergency state that we are seeing in various member states at various points. I mean, one might not call this an emergency state, but these special provisions that have been taken to lock things down, to reduce the right to assemble and so on. And here again, sort of, I think key questions will be raised about what kind of principle should underpin a future emergency state, or even if a highly localized emergency state for that matter. So that raises then for me the final point, and that is what actual transboundary capacities could we sort of talk about? I mean, we can talk, as sort of Lydia and Ian in particular have already mentioned, kind of capacities of organization. So here we can talk about sort of procurement, joint procurement of materials that can be sent to various hotspots, which basically support member states in hours of need. But as we sort of also have seen, this might be partially, kind of successful, but in other cases, questions of procuring materials and so on has not been that successful. And more importantly, when it comes to sort of the national level, it does not basically support health systems that have been sort of basically financially constrained for a long time, and it's very difficult to imagine that the European Union can organize a few thousand nurses if national member states have been unable to do so beforehand. Secondly, one can sort of think about the European Union in the sense of an information provider. So here basically the argument would be it benchmarks, it supports sort of information provision, but here again we are sort of fundamentally moving in a problem that ultimately the numbers are not European ones, but ultimately local and national ones. So here again, I think the key problem or vulnerability of a transboundary capacity in terms of informing decisions is the ultimate dependency on basically local actors to collect and report. Which leaves then, I think in my view, the final sort of capacity, apart from finance, which is, I think, another debate, but the final capacity I want to sort of talk about here is authority. So here, ultimately, one might argue the European Union capacities are not necessarily about sort of the acute management. It will always be sort of a sideshow vis-a-vis the member states that will, kind of move first. And that might sort of be an answer to Ian's sort of initial kind of comments. But I might argue maybe the place for European Union capacities is ultimately in regulating sort of the great, kind of release basically of the lockdown. So here, however, again, sort of questions arise, because ultimately what we're talking about here is highly diverse kind of settings between boundaries. I can already see it even in a sort of now non-EU member state about nobody understands how actually the deal between the United Kingdom and France is supposed to work in terms of non-quarantining tourists, but one might also sort of look at sort of joint protocols for phone apps and such like. But here again, sort of the key question or the key concern is that as much authority as the EU might have in basically developing protocols and schemes and memorandum of understandings and so on, there's always a risk that these turn into fantasy documents when ultimately member states are faced with a public health crisis. Thank you.
Thank you very much, Martin. Thanks very much to all of the speakers for the opening statements. Before we open it up for the Q&A from the audience, I would like to also follow up with a couple of questions for you, because we learned a lot from you about the multifaceted nature of this crisis, that there is an immediate sort of health crisis that needs to be managed, and that is of a transboundary nature. We also learn about the potential effects, on the political system, democratic backsliding, of course, economic crisis management. And first of all, I was wondering whether you could take a closer look at the different phases of crisis management. I think you all hinted at different sort of types of capacities that are needed. For example, when it comes to the acute management of a crisis, for example, the COVID health crisis, delivering capacity on the ground, making sure that enough hospital beds are there. On the one hand, on the other hand, there are questions to do with managing the later phases of the crisis, managing the exit from the crisis, and managing then the consequences or possibly sort of further crisis, that are following out of this health crisis, such as economic crisis and so on. So maybe Arjen first, can you say a bit more about the different phases of crisis management and what are the key capacities that are needed in these different phases if we look at entering and exiting the COVID-19 crisis?
Well, I'd say, for clarity, I would say there's 3 phases. So first you have that creeping phase where you can almost see that crisis coming. And then it's really the art of calling the crisis. When are we saying this is a crisis? And that's a political decision. It should be. And that capacities that are needed is understanding the mechanisms of that crisis. And I was kind of astounded to see that, and I'll just speak for Holland, that appeared to be very difficult. The acute phase is really the easy phase in a way. I mean, that's, everybody looks at you, there's a whole machinery and the dilemmas are clear. And then the hard part is, are we going to go left or right? Are we going to do this or that? And that takes sort of the political leadership that political leaders usually are ready to give. Now we're going back to that, and I think Martin said we're in that twilight zone towards a phase where it's not really a crisis anymore. It's a complex policy issue. How we're going to redesign the society. So we're transferring back to a whole to the whatever we have a whole range of names for that, and we got to do something really difficult, but the leaders sit there with a whole bunch of capacities that they've grown to like. It's kind of cool to sit there and say, hey, I can do whatever I want to do because we have that emergency state going. And of course, that's not going to work if you want to have an intelligent design of a new society. So there's a major clash set up almost that we can witness out in this twilight zone. But I'm sure others will be happy to comment on that.
Yeah, thank you. Lydie, do you want to comment also on the role of the different EU institutions during the different phases?
Yes, I think following Arjen's 3 phases, I think let's start with the early warning and detection. This is really an area where the European Union should have an added value and should be able to bring national member states' expertise together so that we can have a good assessment of the threat. As I said, clearly this is an area where there has been a massive failure because the European CDC based in Stockholm did not see this coming. I think the change of perception, as in other countries, happened in March, which was way too late. So I think there will be a need for inquiries. So why didn't we see this threat coming? And second, how can we really pull better expertise? Because I think that's really where we should have a common assessment, and that's and we should probably think into how we can better equip the ECDC and give the ECDC a bit more power to raise the alarm. The second, in terms of acute crisis management, so really the firefighting, well, actually, this is a phase that mostly rests in the hands of member states because the member states are the ones that have the manpower. European Union institutions don't have control over hospitals, over civil protections. So in terms of really delivering the assistance, the first assistant member states have the most capacities. Here, what the European can do is help a little bit. It did so, for example, by removing the budgeting rules so that member states could really spend massively their budget on assistance. Where the European Union will have, I think, a stronger role is in that third recovery, or whether I think we're still in a complex situation, what Ariane called the complex policy problem. And here, the European Union, I would say, capacity lies mostly in its policy and legal system. So how can we ensure that the rules and the policies across European Union are well articulated to one another so that we can respond well to the pandemics? To give you an example, for example, today, European Union tourism ministers meet to discuss how we could organize the holiday season for Europeans. This is typically a problem the European Union can solve. So this is mostly, I would say, a policy capacity. And I will stop here.
Thank you, Lydie. Nick, what you discussed, the risks of the crisis and the effects of the COVID-19 crisis on democratic backsliding, and that's probably of a much more creeping nature. It's not as acute as some of the other challenges. So what would you think are the particular sort of capacities, coordination capacities needed for the management actually and containment of democratic backsliding?
I think I'd want to make two comments here, one on the EU level and one on the member state level. I think the comment on the EU level is that in terms of the kind of steps that we've been looking at, so detecting a crisis and making sense of a crisis, then moving on to actually making decisions and implementing them and coordinating them, and finally wrapping it up and exiting it. I think with respect to democratic backsliding, rule of law crisis, the fundamental problem with the EU is that it's not really got beyond the first stage. Stuck in the first stage with our big political disagreement about what's going on and how to make sense of it. And I think what we're seeing here is that in terms of the very high thresholds for making decisions at the second level, supermajorities, unanimity in the case of actually taking action against the member states, this is feeding back into the sense-making part of it, with the kind of let's not do anything about this because we won't get anywhere anyway until we have full consensus. So I think here we're not even at the stage where we're thinking about how to exit this. And I think a lot of that's because Article 7 was always thought of as having deterrent value, not an actual value. The second point I think I'd make in reply to your question, go at the member state level, and just to point out that it's certainly interesting and worthwhile to compare the kind of emergency decrees we're seeing in different countries. In Norway, for example, very limited decree giving the government power to change a very limited number of laws, giving 1/3 of parliament the possibility to stop this. So very limited in scope, nature, and timing, as opposed to Hungary, where the power is effectively unlimited in the sense that the decree can be used to do all sorts of things, even though it's meant to deal with a crisis. It effectively lasts until Parliament or the courts, which basically means the Prime Minister says it no longer lasts. So that takes us to the question at the member state level is really whether this becomes a slow burning or an acute crisis is not so much about the decrees that the member states enact, which we can all say, okay, fair enough, you have to enact a decree, it's a crisis, but it's what they use them to do. And that, I think, is why the European Commission is keeping a very, very close eye on what's going on in Poland and Hungary, even though we've got these statements of, as of today, the COVID-19 response hasn't made the situation worse in terms of democracy and the rule of law.
Thank you very much. And finally, a question for Martin about the role of the EU institutions in managing the exit of the crisis. Do you think there is an opportunity for the EU to also re-emerge out of this in a strengthened fashion? What are the key challenges? You talked about stress points earlier and crucial capacity. So what would you see is the role here of the EU, and what are the key challenges?
Well, I mean, I think sort of the way forward in that sense is, I suppose, is to be let's call it a helpful friend who is creating guidelines and some degree of consistency in a way where member states on their own will basically scramble along and basically sort of try to seek solutions on their own without really understanding what the neighboring country is doing. So I think that is where, as Lydia highlighted, one gets sort of talk about how can we think about basically getting a holiday, somewhere beyond 20 kilometers from our place, and so on. Now, I think that is basically, and I think we have sort of similar ideas. We could sort of look at sort of the emergence of crisis regimes, one might sort of call it, which will sort of try to deal with the previous incidents of sort of uncoordinated nature of national responses, such as sort of to bank crisis and so on. So I mean, we could sort of look at sort of the development of schemes here and sort of degrees of expertise and then such like, and maybe we find sort of something here too. Now the problem here, however, is we're not talking just about systemic banks, which are sort of given sort of a special sort of treatment, and even here we might sort of wonder whether these documents are will actually sort of proved to be that powerful when sort of a real sort of bank goes down. Now we're talking here, and I think that's basically where I think sort of with we can have a debate with Arjen a bit. I think sort of I think the interesting question about the twilight zone is it's not just that it's a complex policy issue here with all these sort of creeping things as a consequences of decisions taken. So I think we have a lot of policy as its own course to manage, and that ultimately means decentralized management, ultimately between member states, but also across EU institutions. The centre cannot deal with all the unintended consequences that are emerging from the, from the acute phase, as we may want to sort of define it. The problem is, I suspect, is that there will be many small acute crises coming along which have to do with health, where basically the prioritization of health versus other sort of sectors of life will become more and more acute, and which will require centralization. So I think sort of the critical part, both for EU institutions as well as member states themselves, will be this uneasy compromise between having to centralize when an acute crisis hits, while decentralized management of the unintended consequences. And certainly, possibly with societies that become increasingly restless of being told how to behave and being locked up in that sense.
Thank you, Martin. I would now like to open it up for the questions from the floor, from the audience. We already have received a number of questions. Please continue to post your questions. Use the Q&A button at the bottom of your screen. Gerling Kaur, he asks, are European countries in a position to help other poorer countries who are suffering just as hard, if not more, due to COVID? So this is about Europe, but also looking beyond Europe, and what can European countries do to actually support other countries? So who wants to answer? Yeah, Lydie, please.
I think the European Union can actually still keep on helping other countries, even though it also faces a massive internal crisis. It has actually promoted, well, not the European Union, but some countries of the European Union have been at the forefront of promoting some help for developing countries. We've seen in particular France teaming up with other G20 countries to advocate for a suspension of debt payment for the next 6 months, so that developing countries can have enough financial resources to respond to the crisis. So that is one option. I think then there is the question of whether the European, I would add that the European Union has also been a strong advocate of support to the WHO, which in the current time is essential, because we've seen the WHO challenged by leading countries such as the United States. And the WHO remain an essential international actors to provide crisis coordinations in times of pandemics. The WHO is still essential to help, in particular, African countries tackling this pandemic. And then there would be a third question, whether the European Union can do more through its various aid mechanisms. I am not aware of specific initiatives, but I think that's where probably there is room on the table. That said, for the moment, African countries have been doing much better than Europe at responding and containing the pandemic.
Does anyone else want to respond? Okay. Then let's move on to more questions. We received quite a number of questions. There is a question from Rod Dubitsky, who asked, do you think the global response has failed to adequately consider the cost of the lockdown, i.e. massive government budget deficits, cutting back of government services, rise of non-COVID illnesses, reduction in vaccines for non-COVID disease, etc.? So maybe, Arjen, do you want to respond to this question?
Well, that's going to be the debate, isn't it? You know, whether it was all worth it. And in the end, we may well have a question or an answer to that. But I back to the phase where they were, you know, really living through a deep uncertainty and a major scare. That the models that were then dominant showed that hundreds of thousands of people could die, and the virus might not even go away. And so at that point in time, I think it was very defensible for many countries to take measures that you know, any amateur virologist would probably propose. Now the question now, as we're moving out, is, and I think, you know, that's going to be the real question: how fast can we do that? And what are the and do we know anything about the costs? There you can, I think you can have all sorts of discussions, and I'm not so sure if I don't know. Of course, that's the answer. And but we're seeing an experiment. We're seeing all these different countries do different things. So we'll have winners, we'll have losers.
Thanks, Nick.
Yeah, and in addition to what Arjen's saying, I think we see quite different debates or narratives, or whatever term you want, going on in different European countries. I mean, in the Norwegian press, for example, there's been some talk of the need to take into account the economic value of an extra few months for critically ill people who would have died earlier, or who, if we hadn't taken the corona measures. In Italy, the press has been very much focused on the absolute sacred value of human life, and we've seen that also in the recent debate in the Italian papers about paying ransoms for kidnapping victims. They just bought one of them back. Whereas in Central Europe, particularly in Hungary, we've seen the blame game taken an entirely different form, with the usual blame on international capitalism and George Soros and the European Union and the UN being invoked also in the case of this crisis.
Thank you. Liddy, you wanted to comment?
Yeah, I think in addition to those debates, the question of the cost is not, I think it's a bit more complex, because it would be difficult to talk of a global response, because actually countries have been responding in various ways in terms of cost. So we don't have yet the full picture. I think it's a bit early to give final figures, because we still don't know, how much government spend directly, how much they spent indirectly through taxes. But what we could say is that there are different strategies, and that will have various implications in terms of cost and implication for the society and the economy. To give you one example, European states massively adopted what we call Kurzarbeit, which is a temporary unemployment measure. So which means that employers put their employee temporarily on unemployment, but government subsidize their salary. This is actually a fairly efficient system that worked pretty well during the 2008 crisis in Germany. Because it helps, so it has massive costs for the government, but the cost on the economy will be less, because the economy will be in a better position to recover. This is really different, for example, from the US, where millions and millions of employees have been put on unemployment, which will contribute to the destructions of a lot of jobs, of millions of jobs at companies. This is again very different from countries such as India or African countries that have no or little welfare states to support the cost of confinement. I would say in the case of countries, it's a huge cost, but the welfare systems helps make those costs manageable and to eventually save lives, which in the COVID-19 would probably have just simply overflown hospitals, and we just could not have coped.
I would just re-emphasize also Ian's point and Liddy's point here, and Nick's point. So I agree with all of them, but I think we are talking here when sort of trying to make a point about cost of measures. I think one has a, one has to take very sort of strong normative position here. So one is dealing here with deep uncertainty. One has to sort of consider what would have been the cost or the what would have been the social response to non-action or some other action. And I think that makes also comparison between different national sort of, let's call it, measures quite difficult. I mean, apart from demographic profile, public health profile, population density and so on, I think different societies responded very differently to sort of being alarmed to a threat. And I think that, again, I think might explain possibly even more about sort of certain kind of indicator developments than necessarily the government development on its own, government measures on their own. So I think there's sort of a, I think that will sort of make it even more difficult to come to some kind of final number to say, well, this was this particular cost and it might have been much cheaper. I mean, of course, in the aftermath of all of this, whenever that might be, there will be the accounting offices of various countries will come along and will make sort of money for value or whatever, value for money studies and such like. And of course, questions will be asked about why certain things were there or were not there. But I think sort of re-emphasizing Ian's point about the deep uncertainty at the moment of high threat, I think is something to bear in mind for these sort of ex post inquiries.
Okay, we have another question that actually asked about the relationship between scientific expertise and political decision making. I think it's actually aimed at all of the panelists. So this is a question from Irene, who's a master's student in law at the Aristotle University of Thessaloniki in Greece. Do you believe that giving the podium to medical science, within reason, is putting aside the responsibility of executive power? Do you see a transformation of how actually government is conducted?
I can open on this one. I think this is a very important and relevant question. So thanks for asking it. I mean, I would answer in 2 points. First of all, not all countries have given the podium to medical science in the same way. And actually, this is something very interesting. We see various ways of using medical expertise, in particular across European countries. We see, for example, countries as Sweden or Netherlands that heavily relies on the expertise from their public health institutes and mostly listen to this, even though there are calls for opening up the expertise, so bringing in other kinds of experts precisely to take into account the scars, but they still rely mostly on this. We see other countries as, I think, the UK or France, which have created dedicated experts committee. And here there's also key questions about who sits in this committee. I think there was a bit of contention there in the UK, but mostly medical expertise was there, although there actually also were business people and executive. I will let Martin maybe comment more on the UK because there's a lot to say here. And in France, actually there was an interesting committee with both medical scientists and actually social scientists, precisely to comment on the impact of the confinement on the population. So I think we can't say that the podium has been given to medical science all around the countries. We actually see a lot of variations. And after the crisis, there will be time to ask questions about what kind of expertise is listened to at which moment. Then the second point you raise is, what does it mean for executive government? That is indeed crucial. And again, here we see different answers in different countries. Governments had a tendency to say, we follow the science. And this assumes that science gives one clear advice and then policy implements it. There has been a lot of policy studies and science and technology studies that show that actually it is always much more complicated. In this crisis, we've seen indeed government in France, in the Netherlands, the UK is a bit more complicated, in Germany, that have been saying, we listen to the science, therefore we confine our population because this is the only way to go. And indeed, this is very convenient for governments to say this is what scientists say, so they kind of offload their responsibility. Of course, then scientists are not very happy about that because they only give a recommendation, but they don't make the policy. They're not responsible for the decisions. So despite this communicative efforts from the government to say that they follow the science, what we actually see is that they choose the kind of expertise, the kind of expertise and the kind of recommendation they want to promote. So I'm not sure that we should overgeneralize about the how some medical scientists have taken power. I think there is still a lot to discuss and a lot of variations across countries.
Thank you, Liddy. Anyone else who wants to comment on that question?
Well, let me just add something. I think there's a very interesting paradox because, you know, the deeper we move into the crisis, the less the experts know and the more politicians are pushing for some sort of answer. So this is a really, you know, again, it's some sort of a twilight zone, you could say. So there really is no science on reopening a country after a pandemic. So we're making it up as we go along. And but you know, the consequences of failure are immense. So there's it's understandable that policymakers or politicians look at scientists, experts. The relation has been shifting during the crisis. In the beginning, they knew a lot more than they know now. And but in the end, you know, politicians have to make the decisions. You know, it's just advice. That's all it is.
I think I'll follow up a little bit from what Lydia said, simply about the importance of comparing different responses here. I think one of the things we get if we look at different regions in Italy, and this has been quite well reported in, for example, the Financial Times as well, is the very, very different results in different regions in Italy, based not so much on what the government said, but on their capacity in terms of size of hospitals, in terms of which kind of patients they take in and everything else. I think if you were to look to Scandinavia, you see very, very different government uses of what is actually not that different medical advice. And we see, especially in Norway and Denmark, the governments having taken what Martin and Arjen described as the precautionary approach to this, based on the sort of going against their own medical scientists' advice when it comes to, for example, closing or opening schools, permitting people to use summer houses and things like that, being very explicit about acting and making political decisions that are more cautious than their medical advice, as opposed to the Swedish case, where the medical advice has been very much put in the forefront.
Thank you. Martin?
You know, so I mean, it's really just a footnote. So I don't think we are, you know, in a world of government by virologists or others. But it does make me quite uneasy when the executive power, which is discretionary decisions, hides under a slogan called "led by the science," suggesting indeed that there's no ambiguity within science, and that there's room for discretion. And the concern here is that it will actually pull science into an area where it is on the political venue, which in part might even mean that, you know, science doesn't want to be there, and that might be an unintended consequence, which would be highly undesirable in that sense. I think there's sort of much further points, I think, too, about sort of how government would like to fund science in the future, which arise from this, which go beyond this particular question. But you know, if science is supposed to give answers, then science cannot be sitting here writing research grant proposals, but it needs block funding, basically. And I think that is sort of one more sort of implication, I think, of this episode, where I think the relationship between, let's call it, government and its needs for scientific knowledge needs to evaluate itself. What is the best way to to develop scientific knowledge and which funding and other structures it wants to encourage here.
Yes. Yeah, I think the question also points to a much discussion about the relationships amongst different sets of expertise, so medical science, but also economic science, and of course also humanities. And some countries, for example, Germany, have a commission where there are also people from the humanities actually advising the government, and the relationship and interplay between these different scientists. I have a question directly aimed at Nick, actually, from Carl Schumann, who asked, to what extent can you blame Germany and France for not taking or encouraging more decisive action against Poland and Hungary? So is it an EU institutional problem, or what is really the role of powerful nation states here?
I'd be very, very careful to put the blame on specific nation states. I think if I'm going to sort of, I wouldn't like to call it put blame, but that's what I'm doing, but I'm going to call it explain the very careful, if somewhat timid approach that the EU has taken. I think on the part of the Commission, it really has been been this idea that things are best handled carefully, slowly, without creating large political controversies. In the European Parliament, I think all sides, to some extent, should be subject to some criticism for putting partisan politics above issues of democracy and the rule of law. And this really goes back to a long issue about the role of right-left politics in the European Parliament. I think in this particular instance, with not so much with Poland, but with Hungary, the European People's Party clearly needs to look at the way it decided to hold back criticism from one of its member states. And it is in the process of doing it. It has, after all, suspended the offending party from itself. I think if we were to start looking at individual member states, we would have to look at how they've indicated they might vote in the ambassadors' meetings in the EU. And there we see, for example, Britain being caught up in the middle of Brexit, deciding to stay neutral on this kind of issue. We see a number of the other Central European countries being very, very reluctant to criticize one of their group. And we see other countries, such as Croatia, Bulgaria, and Romania, perhaps being a little bit careful about encouraging the EU to look too closely into breaches of EU law for fear that they might be next in line. So no, France and Germany really do not stand out as big states that deserve any kind of particular criticism here.
Thank you, Nick. I have a question for Lydie and Arjen, and this question has been posed by Frank Friedrich from the Institute of Public Safety and Emergency Management at the University of Wuppertal in Germany. And he asked, usually I would have expected that the EU response mechanism would be much stronger in this crisis, but as you have said, this happened in a very limited way. So in your opinion, what are the major reasons for this, and how can this be overcome in the future?
I think, first of all, I think there was just not the legal system and the policies were just not adequate. Because the European Union has only a shared competence in health, so it can support member states, it can encourage coordination, but it doesn't have really any enforcing power, it doesn't have decision-making powers. So in that sense, it's not very surprising that member states ended up taking decisions on their own and doing whatever they wanted. The ECDC only has an advisory function. The Health Security Committee, which is the most important, I would say, decision-making body at the Commission, well, ends up representing member states, but they do not really make a joint policy. And I think finally, the most specific point in terms of pandemics preparedness, which relates to decision 1082 from 2013, which says that which is about serious cross-border health threat, and that decision is about information sharing for pandemics preparedness. In 2016 already, the European Court of Auditors had said that this decision was really insufficient because there is no incentive for member states to share information. Pandemic preparedness, as often in crisis management, is a lot about very sensitive, confidential informations that member states are reluctant to share. So I think without a regulation to, I would say, provide more common templates and more common procedures for pandemic preparedness, there is no way member states could have had more common policies and easier way to cooperate with one another. So I think my first answer is the legal and policy system was not there. And therefore, it is not surprising that member states were, they are first and foremost accountable to their population. So being accountable to their population will be more important for them than solidarity within the European Union.
Thank you, Lydie. Arjen?
Well, I would add to that that there's certainly an ambition in the European Commission to play a role in transboundary crisis, but unfortunately, it's not been much more than an ambition at this point, and there's not a really thought out idea of what the role of the Commission or its agencies could then be in facilitating coordination between member states that are all being afflicted by the same crisis at the same time. It's just not a scenario that's been thought through, and the only agency that could have played a slightly more forward role is the ECDC in Stockholm. And they've essentially managed the website with stuff that you and I we knew that we didn't need the website of the ECDC, and they've not their role, and there's all sorts of legal reasons why they didn't want to do that. But I also think if you can't demonstrate your added value, as EU scholars like to say, in a pandemic like this, if you're the agency that supposedly sits on all that knowledge, then you're just not advertising the role of the EU there. Sad to say.
Yeah, thanks, Arjen. We have another question that looks about the changing role of the UK in view of Brexit in their sort of coordination, European coordination of the crisis management. So Liz Gagoulis asked, first of all, a question, is the UK still a participant member of the EU crisis management institutions referred to by Lydie, for example, the ECDC that also Arjen talked about? But I think that the question also, we can interpret it more broadly, how do you see the changing role of the UK and the changing relationships between sort of the UK and other European EU member states in actually coordinating and building transboundary capacity in the management of the COVID-19 crisis?
I mean, briefly on the European mechanisms, so because the UK is still in that transition period, in theory, it can still participate to all this committee. It should have had access to ECDC information. It should have been able to participate to joint initiatives such as joint procurement. What has come out in the press is that the UK is not willing to participate in those committees. There has been a couple of rows in the British press about the UK having missed the opportunity to participate to the joint procurements I mentioned, which may have helped the UK having access to more protective equipment at a better price. I mean, this is clearly a political strategy from the UK that is completely coherent from the point of view of the Brexit policy that has been followed by the current executive. In thinking in terms of future, what could be its role in terms of pandemics? I think the fact that the UK has had this, I would say, standalone position, a bit free, not willing to cooperate with the European Union, doesn't mean it hasn't been talking to other member states on a one-on-one basis. For example, with France, we've seen that, for example, France at some point threatened to close the border if the UK was not taking more restrictions against COVID-19, and there has been a set of bilateral actions. I think that is partly the UK solution, but that, as in other crises, and it's something that we've seen in our research, for transboundary crises, being alone and playing alone is very complicated because you do need information from your neighbor. As there is travels between countries, you do need to regulate the flows of goods and human across borders. The UK is very close to all the European Union. It shares a border with Ireland, and is very close also to France and Belgium. So I think that really shows some of the issues and serious challenge that the Brexit will have to face, because in case of such massive pandemics, talking to your neighbor is kind of necessary.
Yeah, Nick.
Yeah, I think in addition to what Liddy's saying here, there's really two very different dynamics at play. One is the short-term dynamic and one is the longer-term dynamic. And if we are to look at countries that are sort of half in, half out, Norway, Switzerland, Iceland, Liechtenstein, for that matter, I think we get a slightly different longer-term dynamic. So the short-term dynamic, I think, has always been towards a hard Brexit, the hardest of hard Brexit within certain parameters in the short term. But I would say that if we look slightly longer term, perhaps beyond the term of the current Prime Minister, but even beyond the next couple of years, we're likely to see Britain needing to engage with the EU on this area and a number of other areas, sort of buy-ins, if you want, the opposite of an opt-out. You can opt out or you can buy in. Buy-ins to all the various mechanisms of the EU, including these ones in the sort of medium term. That would be the lessons from Norway, if there are any.
Yeah, Martin.
I mean, I would suspect, given the toxic nature of anything that is called European Union in the current political administration, that the functional need to think about transboundary problems in a transboundary way will lead to an active exploration of alternative fora. Now, whether they exist, whether they're actually supporting that, whether there's enough administrative capacity to even support such kind of development when another infrastructure is there is sort of somewhat questionable to me. But I think there will be sort of some realizations there. However, I do, I'm quite skeptical about this realization at the same time, because a context which wants to show how brilliant, a country can do without EU membership is not the most likely to search for solutions elsewhere. Although in other areas we do find, kind of quite a lot of proactiveness when it comes to using the G20 as sort of a crisis mechanism. So in that sense, I think it could go both ways. It will be seeking alternative venues, or it will be sort of stuck there and then sort of seek, as sort of Nick would suggest, sort of a long-term settlement on this matter. But I do think that in the current climate, mentioning the EU on a memorandum to a minister or secretary of state will continue to be not very popular.
Thank you. I have one question from John Harvey, who asked actually about the specificities of territoriality and how that affects crisis management in relation to COVID-19. So he asked, why have the boundaryless states of New Zealand and Japan performed so differently, and what could Europe learn from these models, or how would you explain difference? I don't know, maybe this is for Martin, who has done work on New Zealand.
Well, I mean, I think basically, I mean, the positive story about New Zealand is, I mean, if I wanted to sort of, I'm not a particular expert on this, but they would say they went in early, went very hard, and very sort of, and then basically were successful. All tourists were basically, kind of shipped out by various EU missions where we had EU cooperation, was sort of the return of tourists from all sorts of places. You might argue there's a benefit of of kind of an island country which can control its borders quite easily in that sense. it is a country where population density is not very high. So in that sense, many things basically, and you might argue too, sort of in terms of social norms, a highly cooperative society. So all of that basically, you might say, sort of supports sort of the trends that one has sort of seen in New Zealand in this particular kind of case.
Does anyone else want to respond to this question, the role of being an island? Yeah.
I think just very quickly, I think Martin's onto something when he points to things like low density and relative isolation. It's not so much about being an island. I mean, look at Finland. Finland's not an island. Or if you look at Norway and Denmark, again, the really high number of cases came from people who returned from skiing holidays in Italy and Austria. And if you do the counterfactual thinking about if this had happened, not at the moment of those holidays, but later, I think you would have seen very similar dynamics there in terms of not having a lot of cases. So I think the factors that Martin pointed to about low density and isolation are probably as important as the actual surrounding water.
Yeah. And we're coming nearly to the end of today's event, but I would like to pose one last question from the audience to all of you. So this question comes from Leonard Metzen. He's an LSE government undergraduate. And he says, he asked about the relationship between civil servants and political advisors. So what balance should be there between independent civil servants and political advisors in handling crisis, and what impact would this have on transboundary cooperation? Martin.
Well, that alone, wonderful exam question could fill a whole course. But I think sort of across this issue, I think I think across sort of various questions or points we discussed, I think sort of the question between what you might want to call a sort of a non-majoritarian management of a crisis, where we would like, kind of some sort of somehow objective measurement system which gives us a warning, where a bunch of objective people without any biases or disciplinary viewpoints have a clear view, give a clear kind of set of advice to a bunch of politicians who then take difficult decisions, which are willing sort of then to face electoral punishment for these. I mean, in many ways you could argue that sort of the dream world of crisis management. I'm sure Ian will fundamentally disagree with this. That's why I said it. But I think sort of I think this particular case highlights all of these kind of tensions. It highlights sort of when in particular when we come now to the great kind of unwinding, as you may want to call it, this twilight zone, where ultimately you might say this is a moment where majoritarian politics, or politicization you might want to call it, will come back, where basically people will claim that they need to be released into the economy, where other people will say they're not ready yet, or they need sort of some bailout funds and so on. This is a moment where basically really is a kind of, you might argue, what you would call sort of independent advice about sort of whatever numbers might tell you and this dashboard might give you, and basically ultimately political choices, that kind of conflict will come to the fore. And I think that is also why, as sort of also Nick highlighted, it's a sort of a state of an emergency state is a particularly kind of interesting and dangerous one, possibly for liberal democracy, when it comes to this great unwinding.
Yeah.
If I could follow up directly on Martin there, I think the key, the two key issues at hand are kind of public trust in the civil service, trust in the government, and consensus politics. I think we're going to see a big difference between the countries in which the governments are seeking to reach out to the opposition to get cross-party consensus on the emergency measures, on the emergency mechanisms, on the actual measures, and on relaxing the timing. This is something we're typically going to see in Scandinavia, so myself to say Scandinavian bias here. And what we're seeing in some other countries in the EU, particularly in Italy, where we're seeing strong criticism from the far right, particularly Salvini, of the government's handling of this. We're seeing the government's handling of the crisis and handling of the debate about the EU money for the crisis turned into a political football. And I think those, Norway and Italy there, represent in many ways the kind of extremes between turning crisis issues into partisan politics and the efforts very much to depoliticize it. And I think that's important to take into account when you think about the relationship between the government and civil service. It becomes much easier if they try and depoliticize these type of issues, rather than countries where these kind of issues turn into political football, as for example, handling of terrorism has shown us, where it's much easier to come up with sensible strategies if Labour and the Conservatives agree, than in countries where the Democrats and Republicans are fighting each other every day over how to handle terrorism.
Just to add some things over that, I think what's something interesting that is maybe changing or that we're seeing in this crisis, and some evolution about the kind of responsibilities of over crisis management. Traditionally, actually, a lot of crisis management organization, bureaucracies, and plans tend to stay at the backstage from the public. Like they operate actually on a daily basis, but they're not very visible, except in times of crisis. So, which means that the public tend to forget about these bureaucracies that are there and preparing for crisis, while politicians and government are accountable and are accountable for the decisions they make in times of crisis, and governments tend to make sure that their decisions are highly visible. I think one interesting trend that we are seeing is that in this crisis is that a lot of micro decisions about crisis management are heavily discussed by the public, and because it has so much impact on the lives of citizens. And it's not, and it comes to a point that it's not just crisis management, it's a redefinition of the ordinary lives of citizens. And I think we may see maybe a greater oversight of crisis management organizations and plans and the way they operate. I mean, to give you one example, I think there has been a very interesting controversies in France over masks. France used to be 10 years ago one of the country the best prepared in the planet, heavily always topped the WHO ranking for masks, and over the years, it had 1 billion of masks 10 years ago, and in 10 years, this stocks reduced to about 100. So there seems to have been various factors playing there, but apparently one of the main reasons why the stocks diminished to almost nothing and reduced the ability of France to manage pandemics is the evolution of bureaucrats themselves, of the bureaucracies, and the way they made decisions over the transformation of crisis management. And it looks like politicians may not have had a clear understanding of what was happening because it was tiny, it was obscure in the bureaucracy. And now it's being put there in the public places, and there are public discussions about the role of masks in crisis management. So I think this may, I think, change and bring more public oversight and scrutiny in terms of crisis management in the coming years. And it's probably time to stop.
Thanks, Lydie. We are reaching now the end, actually, of this debate. Very rich debate where we probably raised more questions, than answers, touching on many different issues. But some key things to take away is the multifaceted nature, but also the different phases of crisis management. COVID-19. I would like to thank you all for participating in the debate. Thanks a lot to the audience for posting the question. Unfortunately, we weren't able to answer all of your questions. Hopefully, some of those were answered by the speakers when they spoke, answered and gave their statements. I would like to thank all our speakers, Nick, Martin, Arjen, and Lydie, for participating in the debate. And and lastly, I would also like to thank the LSE events team for actually making this possible and acting behind the scenes to make this sort of seamless. So thank you very much, everyone, and have a good rest afternoon or evening or wherever you are in the world. And I look forward to seeing you again in another form of fashion. Thank you very much and goodbye.
Thank you, bye.
Thanks.